Are you struggling with obesity and overweight, poor digestion, phlegm issues, cough, stress, depression, and lack of motivation? Then don't worry. You have solution for all these problems. In this video, I will explain each and every detail about Kapalbhati Pranayama. How to do Kapalbhati Pranayama correctly. What are the common mistakes that you should avoid while doing Kapalbhati Pranayama? Amazing benefits of Kapalbhati Pranayama. Contraindications of Kapalbhati Pranayama, that is, who should not do Kapalbhati Pranayama. Precautions for Kapalbhati Pranayama. Time duration for practice of Kapalbhati. When to do Kapalbhati Pranayama. You will get in-depth knowledge about Kapalbhati Pranayama in this video. So watch the video till end. Hello everyone, Namaste, Sat Shri Akal. I am Sukhwinder Singh and welcome to Yogachaitanya, a channel where you will find free content for improving your physical, mental, emotional and spiritual well-being. So if you are new on this channel, make sure you subscribe so that you don't miss any of the health related tips and updates. What is Kapalbhati Pranayama? The Sanskrit word Kapal means cranium, the forehead, and Bhati means light or splendor or perception or knowledge. Kapalbhati is a practice that brings a state of light or clarity to the frontal region of the brain. This is the reason why Kapalbhati is also known as frontal brain cleansing breath. Kapalbhati is considered as pranayama and Shatkarma as well. Shatkarmas are the cleansing techniques. As per Hatha Yoga Pradipika, there are 6 Shatkarmas, that is Niti, Dhoti, Nauli, Basti, Kapalbhati and Trata. I will talk about them in some other video. According to the ancient yogic textures, there are 3 types of Kapalbhatis, that is Vata Karma Kapalbhati, Vayut Karma Kapalbhati and Shita Karma Kapalbhati. In this video, I will talk about Vata Karma Kapalbhati. In Vata Karma Kapalbhati, Vata, that is wind, air or breath, is used to the cleansing action. In Kapalbhati, we regulate breath in a certain way, so it is considered pranayama. The breath work in Kapalbhati is doing the cleansing action by clearing the excess mucus from the nasal passages and the fluctuating thoughts of the mind. So it is considered as a Shatkarma as well. This is why Kapalbhati falls in both categories. Kapalbhati is also known as Kapal Shodhana. The word Shodhana means to purify. Let's talk about the common mistakes that people do while practicing Kapalbhati so that you can correct them and do Kapalbhati properly. Common mistakes of Kapalbhati Pranayama. First and the most common mistake is the spine of the practitioner is not erect. Generally, people practice Kapalbhati with rounded back and rounded shoulders. The spine should be erect so that the movement of abdomen can happen effortlessly. Some of the practitioners start shaking the entire body while practicing Kapalbhati like this. The torso and the body will remain stagnant. Only the abdomen will move. Some of the practitioner engages a lot of muscles of the face. The face becomes so tense. The face muscle should be relaxed and active exhalation should happen through nose. Another common mistake is over contraction of abdomen in each stroke, as if they are trying to touch the navel to the spine. We are not applying the Udyan Bandha or abdomen lock in each stroke. Udyan Bandha can be practiced after each round if you are an experienced practitioner. How to do Kapalbhati Pranayama? How to practice Kapalbhati Pranayama? Kapalbhati Pranayama has 2 main actions, that is contraction of abdomen and forceful exhalation of breath. Inhalation is passive in Kapalbhati Pranayama. That means it will happen automatically by recoil action of lungs, like this. I'm not doing any effort in inhalation. It is happening by itself. Now let's talk about the contraction of abdomen. Which area of abdomen should be contracted? The exact area to be contracted in Kapalbhati Pranayama is approximately 2 to 3 fingers below the navel and 2 to 3 fingers above the navel. That is the area between the second and the third chakra. The area between Swadhisthana chakra, the sacral chakra, and Manipura chakra, the solar plexus. That is the area from here to here. And the pran vayus that are working in Kapalbhati are Apana Vayu and Samana Vayu. To know about the details of pranvayus and the role of pranvayus in the human body, watch this video. The link is available in the I button and the description tab. To practice Kapalbhati Pranayama, sit in any comfortable posture like Vajrasana, Adamantine pose or Thunderbolt pose, Padmasana, that is lotus pose, or any cross-leg posture like Sukhasana or Ardha Padmasana. Make sure your spine is straight. You can take cushions or a yoga block to elevate your hips slightly. This will help you keep your spine straight. In case if you cannot sit in any of these postures, then simply sit on the chair with a straight spine. Choose whichever is comfortable for you. Place the hands on knees in any desired mudra. You can refer to this playlist to choose hand mudras for your requirements. The link is available in the I button and the description tab. Close your eyes and relax the whole body. Now inhale through both nostrils and forcefully exhale through both nostrils and contract your abdomen. Inhalation will be passive, like this. This is one stroke. Take a little pause between each stroke. So it becomes like gradually increase the pace as you become expert in this practice. Time duration for the practice of Kapalbhati Pranayama. I'm not a big fan of declaring the exact time duration for pranayama practice. The point is, do it correctly with comfort. A beginner should practice Kapalbhati Pranayama at very slow pace with pauses in between each stroke and round. A beginner can practice 5 to 10 strokes in each round and can do up to 2 to 3 rounds. Intermediate practitioner can increase the speed of strokes and can do up to 4 to 5 rounds of 15 to 20 strokes each. When to do Kapalbhati Pranayama? When should we do Kapalbhati Pranayama? Kapalbhati Pranayama should be done in the morning, empty stomach after the asana practice. Kapalbhati Pranayama provides a cleansing action. It purges the lungs and the nasal passages and awakens the energy channels. It prepares the body for upcoming pranayama and meditation. You can do Kapalbhati Pranayama in the evening, but make sure your stomach is empty and don't do it late in the evening. What are the benefits of Kapalbhati Pranayama? Benefits of Kapalbhati Pranayama. Kapalbhati Pranayama is a vitalizing pranayama and a hyperventilating technique. It increases the alveolar ventilation and helps to reduce the carbon dioxide in the blood, thereby increasing the oxygen prana level in the body. This pranayama stimulates the blood flow in the lungs and in other areas of the body where blood circulation is sluggish or even dormant. Kapalbhati Pranayama is good for people suffering from low blood pressure. The practice of Kapalbhati increases the lung capacity and strengthens the lungs. It is helpful in respiratory disorders such as bronchitis and sinus. The regular practice of Kapalbhati tones the digestive organs and improves digestion, poor appetite, and eliminate gastric problems and constipation. The practice of Kapalbhati has a stimulating effect on the whole body. Kapalbhati Pranayama increases the pitta level in the body, thereby increasing the metabolic rate of the body, which helps in weight loss. So if you want to reduce weight, then you must practice Kapalbhati Pranayama. Kapalbhati Pranayama has a heating and purifying effect on body and mind. It generates heat in the body, which helps to remove toxins and waste from the body. The cleansing and detoxifying effect of Kapalbhati Pranayama improves skin quality. The regular practice of Kapalbhati Pranayama increases the glow on the face. La la la, la 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 la. It prevents acne and it has anti-aging effects on the skin. The practice of Kapalbhati tones the digestive organs and removes the excessive fat from the digestive organs. This helps in proper secretion of insulin from the pancreas. Kapalbhati Pranayama is very helpful for diabetic patients. When we practice Kapalbhati Pranayama, the entire nervous system becomes active. It has an awakening effect on brain and nervous system. It helps to balance and strengthen the nervous system. The hyperventilation effect of Kapalbhati Pranayama increases the oxygen and prana in the body and brain. It activates the brain cells, thus it improves the memory and concentration of the practitioner. Kapalbhati Pranayama has a de-stressing effect on mind. It boosts the production of endorphin and reduces the stress hormones. It helps to release stress and tension and uplifts the mood. Kapalbhati Pranayama increases the pitta and balances the kapha dosha. So if you have phlegm issues, cough, congestion, lethargy, depression and lack of motivation, then Kapalbhati is for you. Kapalbhati Pranayama is useful for spiritual seekers since it reduces sensory distractions, thoughts, visions and mental chattering. It calms the mind and prepares for meditation. Who should not do Kapalbhati Pranayama or contraindications of Kapalbhati Pranayama? People suffering from severe heart disease and uncontrolled high blood pressure should avoid Kapalbhati Pranayama since it can exaggerate the problem. Blood pressure patients can practice Kapalbhati Pranayama at very slow and comfortable pace, but always consult your doctor before doing it. If you have brain and nervous system disorders, then you should avoid Kapalbhati Pranayama. People suffering from vertigo, epilepsy and stroke should not practice Kapalbhati Pranayama. If you are struggling from asthma and tuberculosis, then you should avoid Kapalbhati Pranayama. If you have an abdominal injury or if you are recovering from a surgery, then avoid Kapalbhati Pranayama. Hernia and gastric ulcer patients should not do Kapalbhati Pranayama. Pregnant women should avoid Kapalbhati Pranayama since it creates extra pressure in the abdominal region. Kapalbhati Pranayama is also known as fire breath since it decreases the heat in the body, the fire, the pitta in the body. If you have acidity, heartburn, then you should be cautious with Kapalbhati Pranayama. If you have spinal injuries, then avoid Kapalbhati. Abdominal movement during Kapalbhati can exaggerate the problem. Generally, it is not advised to perform any intense yoga practice during the first few days of menstruation. So females can avoid Kapalbhati Pranayama during the periods. But it completely depends on a particular female and her body type. Further, it depends on the amount of discomfort or pain female experiences during the menstruation. Thus, a female practitioner should always follow her body signals before practicing Kapalbhati Pranayama. A lot of females struggles with period cramps during menstruation and they are not able to do the normal activities of the days. Yogachaitanya's period cramp relief herbal tea is highly beneficial in period cramps. It contains the perfect combination of natural ingredients that has been carefully selected to ensure quality and efficacy. This tea helps to relieve menstrual cramps, balances hormones, reduces stress and anxiety, and elevates mood. Our wellness teas are available at heavy discount and free shipping in India. You can use coupon code YCU25 to get an additional discount of 5%. This discount is valid for limited time, so order it now. Link to the period cramp relief tea and coupon code is available in the description tab. Precautions for Kapalbhati Pranayama. Kapalbhati Pranayama should be practiced empty stomach. Beginners should practice Kapalbhati at a very slow pace with pauses in between each stroke. Beginners can take several breaths in between each round. You can discontinue the practice in case if you experience dizziness. People struggling with excessive heat in the body should practice Kapalbhati Pranayama very carefully, since this practice increases the heat in the body. Do not practice Kapalbhati Pranayama late at night, otherwise it will awaken the mind and body, and you will not be able to sleep properly. If you want to improve your breathing and learn each and every detail about breathing and pranayama, then watch this playlist. The link is available in the I button and the description tab. I hope you liked this video and it added some value to your life. If you like our work, please like, share and comment. We are open for the feedbacks. We have detailed videos coming up on different pranayamas and yoga postures after this video. So make sure you subscribe to the channel and press the bell icon so that you don't miss any of the health related tips and updates. Thank you so much for patiently watching this video. Namaste, Sat Shri Akal. Take care. God bless you all.